Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Brandon, thanks for joining me on Here for Good, the Inside Edition.
Thank you for having me.
No, listen, I love talking to our colleagues and hearing their story and things about them that I think contributes to us being here for good. Let's start by talking about your journey.
I started with Virtua in 2008 in December. So I've been here almost 16 years. I started out as a medical records assistant.
You obviously were instrumental in that transition from paper to our current EMR with Epic. Tell me about that transition. Was that more difficult than you thought it would be?
It was actually faster than I thought it would be because it was so instantaneous with care once we went electronic. So when we had paper charts, we would get telephone calls. They would write it out on a pink slip. They would put it in a bin. I would grab the paper and put it on a paper chart that we had in the storage, and I would put it on a cart. I would get a couple of those, take the cart around the office, take it doctor by doctor by doctor, put it in a pile.
Oh, so you were happy when the electronic medical records came in.
I mean, I was a little bit skinnier, that's for sure.
So obviously you engage with a large number of patients on a daily basis, on a weekly basis.
Yeah.
How do you make sure that each patient is treated like a unique individual?
Well, you have to go into each patient interaction with a fresh mind. Not every patient is going to be the same. So you would almost have to put yourself in their shoes and be treated exactly how you would want to be treated when you go and call your primary care doctor. And Virtua expects you to give the outstanding patient experience. So you want to give the care you would want to receive.
Are there any physicians or is there anyone that you really sort of look at as sort of your gold standard, someone that you look up to in terms of the way patients are handled?
When I first came to Virtua, Dr. Campagnolo actually interviewed me for
Really?
Virtua, yep, 16 years ago. So
Well, Mary's a great doctor.
absolutely.
So you got off to a good start.
Yeah. She's all about family care and seeing the entire family. So from grandparent to infants that are just being born, we see them all at our practice. So each level of age is a different care for the patient. So not every day is the same. So you're seeing so many different type of appointments. So you have to go in with that fresh mind that every interaction is not going to be the same. So you have to give the care and you have to focus on what they need.
And you develop, great listening skills.
Yes.
And I think Mary does a phenomenal job of that. And so you have a great role model. But I'm sure there are others that inspire you. Let's talk a little bit about your family.
They are my everything. So when I started with Virtua, it was just me and my girlfriend at the time, which is now my wife. So I have a whole family throughout my Virtua time. So now I have a 12-year-old and a 9-year-old, and my life revolves around them. So like they're my everything.
So you spend a lot of time. Is there anything that you guys love to do as a family? I mean, they're at that age where they're very active, and I'm sure into everything.
My children play soccer, and my son wrestles. My daughter's in band. She's in chorus. She does dance.
So you're a coach, a chauffeur, a concierge.
Absolutely, yes.
What about yourself? Are there any other passions that you have and things that you enjoy doing?
Yes, I am into sports memorabilia. I'm a Philly sports guy, so 4 for 4 for me. So
See, they didn't tell me that before we booked you.
Oh,
on the show,
no.
but that's okay. That's okay.
Yeah, so I actually travel. When I do my vacations, I actually plan on purchasing something in that area. So I'll go on Facebook Marketplace and see if there's anything available in that area. So I've traveled to Virginia for a bobblehead before.
What sort of spurred this this passion around sports memorabilia, and what is it about bobbleheads that would make you drive to Virginia?
I just love it. I like the hunt even more than the acquiring. So like the one in Virginia was a 3-foot gritty bobblehead. So like it was like unique bobblehead.
So you actually have a 3-foot bobblehead?
Absolutely. A orange, scary, gritty. Yes. Yes.
So you mentioned you've been with Virtua 16 years,
16
give or take?
years.
Yeah. What's kept you here?
It's a great company to work for. The benefits, the people, they're always trying to make it better.
And do you see the work that you do as being part of that continuum? Do you feel like your role has an impact on ultimately our purpose and our mission of being here for good, making sure everybody is treated as a unique individual? Are you able to connect the dots?
I'm kind of the patient whisperer. So if there's an issue up front, I'll go and discuss with the patient what's going on, because I can give a little more time than the front desk can do, because they're checking in, checking out, picking up phones. So I can dedicate time to that person.
At the end of the day, you are a problem solver when it comes to helping patients to navigate their healthcare journey and making sure they get with the right people at the right time.
Yes.
And that, in a nutshell, is why we really like featuring folks like Brandon on Here for Good, the Inside Edition. So join me next time for another inside look at our great colleagues here at Virtua Health.